Diabetes can have an impact on various parts of our body, including the skin. Some skin changes occur in the later stages of diabetes, while others can be an early sign of the condition. In fact, skin problems may sometimes be the first indication that someone has diabetes. There are certain skin conditions that are commonly associated with diabetes, but other changes can be more general and affect anyone. However, people with diabetes tend to develop these skin issues more easily. Let's go over these signs one by one. Hi, I'm Dr. Marcos, and welcome to the You Stronger channel. Before we dive in, I'd like to invite you to share the city you're watching from in the comments below. Have you ever noticed a darkened patch or a velvety band of skin at the back of your neck? It's not limited to the neck. It can also appear in areas like the armpits and groin. This condition is often seen in individuals who are overweight or obese. Medically, this condition is called acanthosis nigricans. It is an indication of elevated blood sugar levels and could be an early warning that someone might have diabetes. If you notice such skin changes, it's important to consult your doctor. Early detection can help prevent complications down the road. Another notable skin change is skin tags. It's common for people to have a few skin tags or small growths on their skin, which are typically harmless and not a cause for concern. As shown in this image, numerous skin tags along with darkened patches of skin can indicate high blood glucose levels. These growths are most commonly found on the eyelids, neck, armpits, and groin area. You may also notice yellow, reddish, or brown patches appearing on your skin. This skin condition typically starts as small, raised bumps that resemble pimples. Over time, these bumps can develop into larger, swollen patches of hard skin. The patches may appear yellow, reddish, or brown, and the surrounding skin may take on a shiny, porcelain-like look. You may also see visible blood vessels under the skin. This condition can be itchy and painful. The disease follows a cycle of being active, then inactive, and possibly active again later. The medical term for this condition is necrobiosis lipoidica. If you notice these types of skin changes, it's important to get tested for diabetes. Another significant change in the skin is hardening or thickening. About 1/3 of people with type 1 diabetes experience digital sclerosis, which leads to a thick, tight, waxy skin forming on the backs of the hands. The joints in your fingers may become stiff, making movement difficult. Sometimes this condition also affects the toes and forehead, and rarely, the knees, ankles, or elbows may become stiff as well. Managing blood glucose levels and physical therapy can be beneficial in these cases. Using a moisturizer can help soften the skin. Another common skin condition seen in people with diabetes is diabetic dermatopathy. It causes spots that create slight depressions in the skin, which are often barely noticeable. These spots usually appear on the shins, but in rare cases, they can form on the arms, thighs, trunk, or other parts of the body. The spots typically don't cause any discomfort. For these reasons, many people mistakenly think these spots are age spots. However, unlike age spots, these marks and lines typically start to fade within 18 to 24 months. Diabetic dermopathy, on the other hand, can remain on the skin for an indefinite period. In rare cases, people with diabetes may notice blisters appearing suddenly on their skin. These blisters can be large or in groups, and they often show up on the hands, feet, legs, or forearms. They resemble the blisters you might get after a severe burn. However, unlike burn blisters, these do not cause pain. Eruptive xanthomatosis is another skin condition commonly seen in those with uncontrolled diabetes. When these bumps first appear, they might look like pimples. But unlike regular pimples, they quickly turn a yellowish color. These bumps are typically found on the buttocks, thighs, elbows, or the backs of the knees, but they can form anywhere. Regardless of where they appear, these bumps are often tender and itchy. The good news is that they usually go away once blood sugar levels are properly controlled. People with diabetes are also more prone to frequent skin infections, both bacterial and fungal. Common bacterial infections include styes, which affect the eyelid glands, folliculitis, infection of hair follicles, and carbuncles, deep skin and tissue infections. Fungal infections are very common as well, particularly in areas of the skin that are warm and moist, such as under the breasts, around the nails, between the fingers and toes, in the corners of the mouth, and in the armpits and groin. Some of the most common fungal infections in diabetics are jock itch, athlete's foot, ringworm, and vaginal infections that cause itching. Having high blood sugar over a long period of time can lead to poor circulation and nerve damage. If you've had uncontrolled diabetes for many years, this may have developed. Both poor circulation and nerve damage can make it harder for your body to heal wounds, especially on the feet. These open wounds are called diabetic ulcers. If you have diabetes, it's important to check your feet every day for any sores or open wounds. Diabetes can also cause localized itching, which might be triggered by yeast infections, dry skin, or poor circulation. When poor circulation is the cause of itching, it's usually the lower parts of your legs that itch the most. You may be able to manage the itching on your own by limiting your baths, especially in dry conditions. Use a gentle soap with moisturizer and apply a skin cream after bathing. To wrap this up, if you notice any of the signs mentioned above, it's important to look for other risk factors such as obesity, a family history of diabetes, or a sedentary lifestyle. Just one of these signs alone may not directly mean you have diabetes. They could be related to other health issues too. But if you're over 40 and fall into these high-risk categories, it's a good idea to check your blood sugar levels regularly. Early detection of diabetes and taking precautions can help avoid many complications down the road. I hope this video has been helpful. Please share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. This will help the content reach more people worldwide. Thank you so much.
Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.